Some of what's happening in skincare today was influenced directly by research done right here in Omaha, and that's also true as we look ahead.
About 30 trials are happening now at Skin Specialists PC, and that's part of the story. I recently sat down with Dr. Joel Schlessinger to get a more complete picture of his practice. Well, he's renowned all over, and we're so fortunate to have Dr. Joel Schlessinger in Omaha, taking care of all of us. I'm a patient here, so that's why I'm glad to bring all of you along. From Skin Specialists PC, Dr. Schlessinger, thank you for having us out.
Great to have you here.
Thank you. I know, as a patient, I feel like you're very unique here. From your point of view, why is that so? What sets you apart from other clinics in Omaha?
Well, you know, hopefully we're the same but different in so many ways. And, you know, one of the things that we try to do is to make sure that we offer a unique experience and really make it an experience. You know, you can get something that is the same but make it different and make it special. And in our situation, a lot of it revolves around the staff that we have, the experience with the staff, the experience with the providers, whether it's myself, whether it's my physician assistants, and the idea that we have an opportunity to not only make people better, but show them their progress and make sure that we make a difference in their lives at the same time. So we take pictures of just about every condition that we treat, whether it's acne, whether it's Botox, whether it's, you know, something else. Right. And by the way, we do in many ways treat a lot of cosmetic as well as medical treatments, and those treatments are something that we do that people may not understand, that we have medical dermatology as well as cosmetic dermatology. Which
is the last I was here because I had an allergic reaction of some kind. It was like SOS. Dr. Schlessinger, I need help really fast. And he did. He got me on the right track quickly. And there's another patient that I know you're visiting with today, Jessica, and she's someone you took pictures of, as you did with me, as you do with everybody, early on. She came into you with what kind of concern?
So she had acne. She's a teenager. She was entering high school, and she came in. She didn't have the complexion that she wanted, and it was so exciting to see the progress that we could track of her improvement over time. And that's something that is just remarkable, and it's just affirming every time that we do it. I'm very solution-oriented, and one of the things that's great about being a doctor and being solution-oriented and being in dermatology is that you can make differences, whether it's on acne, whether it's on eczema, warts, you name it, cosmetic treatments, but you're making differences in people's lives, and you're making things that they can do and improve their lives and feel better about themselves.
So most people come to you because they have something medically going on? Is that the case?
We're about 60% medical, 40% cosmetic. And
in the cosmetic world, you've been on the Morning Blend before talking about some really exciting things, and Dr. Schlessinger, he doesn't brag on himself that much, so I'll do it for him. You are on the cutting edge, where you are involved in a lot of these trials where they come to you and they ask for help developing, making sure these things work great for patients. And then ultimately you bring them to your patients. So what are some of the things that are happening now that people are really pumped about?
Well, a new thing is Filipina, which is a new treatment for cellulite. And cellulite is, I think, the bane of existence for many, many American women and men, by the way. About 10% of guys get cellulite too.
How does it work?
So it actually goes in, this treatment goes in, and it actually takes those fibrous bands and clips them so that they can come up and they are no longer retracted. So it's a solution that is probably going to be pretty much permanent. We have 2-year and almost 3-year data out showing that it works, and it stays up. Now, obviously, if you get new cellulite, that would need to be treated down the line, but if you have cellulite, we clip the band, it goes up, it's staying up there.
People have been thrilled with the results.
Really, it's been a game changer for cellulite, because there have been so many treatments. I mean, you see treatments every time you turn around, either in doctor's offices like endermology, or even on the news like the fibro band or whatever, those things that you see, but they're temporary solutions, and most women want a permanent solution.
Yes.
Something that they don't have to go in. Now, of course, if you do these other treatments, they can temporarily improve you, but these are long-term. The other things that we've been involved in have been so remarkable, like medications that are there for people that didn't have any options before. We did a trial on something called Humira for hidradenitis suppurativa, and that was something that was remarkable, and it brought a product to the the country and to people that wouldn't have been available otherwise, that is for a condition that leaves boils or cysts in the underarm or on the body. And it was really remarkable what we were able to do with that. I was very proud of that.
Just a few examples, but you've been doing this for years. It's part of your legacy here, and I think that feeds into the reputation. People know what they get when they come to see you. It's about solutions, as you said earlier. That's why you're here.
And it's also about knowing what those solutions are, because, you know, sometimes, Mary, drugs that come to the public aren't as good as they're cracked up to be. And there have been a couple of cases where I've known that drugs they're going to be a little iffy, and we've taken a pass on using them for our patients because we knew they weren't going to be so great because we've done the clinical trials on them. And that's an important thing too.
We have the clinic space, but then tell us about the space we're sitting in right now.
So this is our spa. We've had a day spa since 1996, actually, the first med spa in Omaha. And the day spa offers things like facials, peels, silk peels. We have Pellevé, which is a treatment for superficial wrinkles. We have Pellifirm, which is a treatment for just body contouring. There's so many fun things that come in here. I have patients who say, I want to spend the day here and
Right.
keep on doing it. It's fun.
And when you see the before and afters, you go, man, this stuff is amazing. And so sometimes you just need that little bit of inspiration to give it a try. But it's all of that. It's cosmetics. Of course, you have the retail store, just so much happening here. Where can our viewers find you, especially those new patients who've heard about you and want to meet you and see what you can do for them?
Well, of course, they can go to our website, LovelySkin.com, and there's a little part on top that connects them to the clinic, to the research trial area, and then call us at 334-7546.
Dr. Schlessinger, thank you.
Thank you,
Always
Mary.
good to see you.
It's great to see you too. Thanks.
Here's a look at the information Dr. Schlessinger just shared, the address, the phone number, the website. It's an award-winning practice mic for a good reason.
Okay, a new special